Welcome, Namita. You're a physio at Complete Sports Care.
Thank you, Peter.
No worries. Thanks for coming. My name's Peter Malliaras. I'm a physio at Complete Sports Care as well. And we're just going to do a quick question and answer about a very, very common type of shoulder pain called rotator cuff related shoulder pain. So, Namita, can you tell me what is rotator cuff related shoulder pain?
So, Peter, as the name suggests, rotator cuff related shoulder pain basically means that the rotator cuff muscles, which we simply call them as SITs, which is your subscapularis, supraspinatus, infraspinatus, teres minor, major, the tendons can get affected due to load, and sometimes there can be tears in these muscles which surround the shoulder. And sometimes there is a bursa which can get inflamed.
Okay, so there's a number of tissues that could be affected. And what causes rotator cuff related shoulder pain?
So there are a lot of lifestyle related causes, like you can say, and physical causes, which can be like muscle weakness or being deconditioned due to lack of activity. Sometimes medication use like steroids can lead to weakness in the tendon. Smoking, comorbidities, health comorbidities like diabetes, cholesterol, inflammatory arthritis, all these can contribute to rotator cuff related shoulder pain.
How does someone know they've got rotator cuff related shoulder pain?
So the most common signs for rotator cuff related shoulder pain would include taking their arm, there's pain with taking their arm overhead or taking their arm sideways and up, or they'll have pain when they're trying to reach their hand behind their back, trying to get their wallet or reaching the back pocket. Or sometimes they can have pain even sleeping on the affected side as well. So these are some very common signs which you can see, but they'll have maintained range of movement through these movements.
And that differentiates it from, say, something like frozen shoulder.
Yes, definitely.
Adhesive capsulitis where it's very, very stiff. Okay. Do people need a scan to know they've got rotator cuff related pain?
A lot of patients ask that question, Peter. It's a great question. And usually it's a clinical diagnosis. So you just need good clinical history combined with a proper physical examination. And that's enough to make the diagnosis. And a scan is not required. The only reason sometimes someone might require a scan is if after a few weeks or months, I would say 3 months of good progressive rehab, their pain is not changing or might be getting worse in terms of their pain intensity or other symptoms. That's when they'll need a scan.
Fantastic. And how do you treat it? How do you treat this problem?
Usually there are a couple of factors which include treating. The first line, the first course of treatment would include lifestyle modification, exercise, movement, a lot of increase in activity, increase in exercise, and going through a progressive rehab plan over at least 6 to 12 weeks. Combine that with a lot of education about what's happening. And apart from that, we can do some other treatment modalities like taping, dry needling, mobilization of the shoulder and the thoracic spine. So these are mostly, I would say the most important aspect would be exercise and education and lifestyle modification.
I just want to pick up on a point there. You did mention initially that sometimes people with this type of shoulder pain have tears reported. And it's really important for people to know that even if they do have tears, all of the treatments that you've just described, which are non-surgical, are beneficial and do improve people's symptoms, and they allow people to recover from this type of shoulder pain, even if they do have tears reported. The pathology doesn't worsen and isn't made worse by movement. In fact, you see an improvement. Another interesting point to make is that some people are fearful of movement because they think maybe the tear or the pathology will get worse because activity causes it. Why should we do exercise to make it better? But what we do know is that progressive exercise, as you've been describing, does improve pain and function, and it doesn't worsen the pathology that people present with. So it's part of getting stronger, it's part of getting more tolerant to taking loads, and it's part of the management for this condition. So thank you for that. Okay, we're almost there. The next question is, should you consider surgery for something like this?
That's a very commonly asked question, Peter, and that's a good question as well, because a lot of time patients ask that. And the good news for rotator cuff related shoulder pain is that 80% of the population, they respond really well to exercise therapy. And if they can continue with a progressive rehab for 12 weeks, as we've mentioned, then they usually don't require surgery. Most of the time, people recover very well with strengthening over 6 to 12 weeks, I would say.
Great, thank you for that. So try exercise first, try non-surgical treatments first.
Definitely.
Okay. Now, last question I'm going to ask you. A lot of people get really, hung up about pain and not doing damage and how much pain is okay with exercise and with movement. What would your advice be?
That's a great question, Peter. And my advice would be a most important thing to take from this question is that pain is not equal to damage. If we stop using our shoulder completely because of pain, it can lead to further deconditioning and muscle weakness, which can start that cycle of making our symptoms worse. So what my advice would be that as you're progressing your rehab, there will be some time post your exercise session that you will feel some pain, and that's absolutely normal. As long as your pain settles down in the next 24 hours and it does not increase, usually we say on a pain scale of more than 3 out of 10, during the exercise session, that's fine. It's absolutely normal to experience some amount of pain because you're building strength.
Yeah, thank you very much. And the other thing I'd just add to that is that it's also important to modify activities that are too painful in the short term. Just modifying activities that are too painful and making sure that you're doing activities that are not too painful, and then progressively recommencing activities that were initially too painful. And that's what tends to happen during the rehabilitation process. All right, we've covered lots of ground there, Namita. Thank you very much for that. And I'll see you next time.
Thank you so much, Peter, for your time. That was great. Thanks a lot.